And I'll hand you over now to Amal to speak about his pharmacist view. Thank you very much.
Hi, everyone. Thanks for joining. My name's Amal, and I'm a community pharmacist, and I've just been asked to share my experience and how I feel about the service so far. So, like all of us, we were presented with this service a while back, and for me, I went through the service and looked at the specs, like Alison said, the six. I'm going to focus mainly on the clinical pathways. Um, and for me, it was an absolute game changer. It's an opportunity for us to actually support our patients and go that little bit further than we had previously. And the context I'm putting it in is how many times have people come into our pharmacies with an insect bite or a sore throat, and we know what they need, or a UTI, and we really want to treat them, and we know what they need, for example, flucloxacillin, a UTI, some nitrofurantoin, and we've had to turn them away, and they say, I can't get into the doctor for a week. So for me, this service really puts us in a position to, one, be ambassadors of the profession, to say that we are clinicians and we're able to treat patients. So how did I prepare for this? And that's a big question. Big thing, big change for us. For me, I started with engaging with the team. So we've all got our dispensers, our ACTs, and making sure they fully understood what the service was and what we're able to do and what we're able to offer farmers, our patients, not just from referrals, but from patients just walking in with queries, maybe say, I've got a water infection. Can I buy some cystitis stuff? So that's immediate for me, the staff, to say, can you speak to Amal, or maybe ask some further questions to get more involvement. So is looking at both avenues, that we do get referrals in, but for me as a team, it's capturing the people that actually walk into our chemist. So I spent a lot of time engaging the team, making sure they understood the scope of the practice and knew what the age range is, like Alison eloquently described, for otitis media or UTIs. And for us, we've been pharmacists for a while. There'll be a range of experience out there, and it's just building on the knowledge we've already got. It's just taking that little bit step forward and using our skills to ascertain what's the best course of action for these patients, and seeing the consultations through to the end. So is it the journey from the customer, from attending not feeling well or not too sure what's wrong with them, is to have effective consultations with these guys and take them to the end. So how did I make this service a success? How do we make it a success? And I feel like I've done quite well in the beginning with it. And for me, was the big thing was, next slide, please, Alison. The big thing for me was, how do we engage our surgeries? The biggest thing is, do our surgeries understand? And as pharmacists, we sort of keep ourselves a bit separate from the doctors in some cases, but this is an opportunity for us to get into the surgeries, speak to the practice managers. But for me, is more importantly, I spoke to all the girls that answered the phone, so the triage in the morning. So I explained to them the service. Spent about 10 minutes talking them through. And a top tip for me was, I printed out the 6 pathways, who can be treated, what can be treated, and how it can be treated. I laminated them and said, look, put this by all your phones, guys. And if any of these patients turn up with these sort of symptoms now, as well as a minor ailment, we can actually help you. We can take that appointment away from the doctors, and we can see the patient in our pharmacy today. Um, and we agreed a sort of pathway between me and them. And it'll be different in different localities, depending on your relationships, how you get on with your doctors, or how you get on with your practice manager and the receptionist staff, because they are key. The person at that desk is the person that's the most influential in triggering a referral for us. And once I'd done that, I saw 1 or 2 coming through, and it was about going in every day, every other day, saying, look, you must have had, how many phone calls did you have this morning, guys? And he said, we had a few. I said, I haven't seen a single referral this morning. You're telling me that nobody had a minor ailment or something I could have had a look out for you? So as they got their head around it and understood that we could take 10 appointments off them that day, that free up the GP capacity to deal with other things, they really engaged with behind the service. So it's important to have numbers of, for example, I have numbers for all the receptionists and all the staff in the back that will text me, Amal, can we treat this? Can you treat that? And it's important to have that dialogue and keep it live on a daily basis. If if you're next door to a surgery, fantastic. Like myself, I can walk in every day. How's it going, guys? What sort of referrals can we send today? And it's really important that we really passionately get behind working together with the surgery. And I think for me, that was the leveler to make this service a real success for us. And we have to, like Alison quite clearly said, we have to make it a success, because we've been given this golden ticket to say we are now not just people who stick to labels on boxes and say take 1-3 times a day, come and I'll see you in 6 weeks, or here's some amlodipine, I'll give you a new medicine service. We can actually treat you, we can examine you, we can understand your condition and actually go that little bit further and hopefully help to treat you. The other part of it is the next slide is community engagement. Obviously, Alison mentioned that there's going to be some media campaign, but we see our customers on a daily basis, and we see mothers with young children. We see women. We should be talking to them all the day. Say, if you get a prescription, for example, for doxycycline, what's the doxycycline for, Mrs. Smith? And they'll say, oh, I've got sinusitis. I'm waiting for a week for an appointment. I said, did you know next time if something like that happens in your friends or family, I can treat you. I'm here to do it. We're able to do this now. So self-promotion is key. So surgery relationships, massive. Number 2 is get out there, get your teams involved to speak about the service. It should be a continual chatter on the counter that, you know what, if you get bit by a insect bite, a horse fly, or whatever, we can help you now. It's not a matter of I have to refer you to the doctor. We're in a position that if it's appropriate, we can help to treat that condition. A part of the big part of this, the next slide, please, Alison, is effective consultations. Now, I think a lot of us would have started off, depending on what experience or if we're IPs or not IPs, is the consultation's key. And creating time in our busy pharmacies is the biggest challenge we have today. Is we have a contraceptive service, we have APBMs, we have blood pressures, we have NMS, we have 1,000 plates to spin at the same time. And the trick we have to sort of get our head around is how do we create appropriate time to, one, give safe and effective consultations, because we don't want to rush them, make decisions that are, because they're time critical, we've got someone waiting for a prescription. Is we need to be looking at our skill mix within the branches. Have we got an ACT? Have we got enough people in the dispensary to manage the workload while our backs are turned? Because as this service grows, I think all of us are going to find ourselves pulled into the consultation room more and more for different services. So really look at your teams, look at what they're capable of. If you work for a multiple or you work for a small chain, is go to your team leaders or your managers or your senior teams and say, look, this is what I'm delivering now. This is the growth projection. These are the hours I need to effectively continue with this service and safely and appropriately. Again, with the service, I don't want to go on about the consultations, but a big part of it is observations. If people walk in, if they're poorly. Look, 80% of your consultation is when they walk through. You can tell the way they sit, if they're holding their back, if they look pale, if they look sweaty or clammy. Use your observations. We're good at it. We've been doing consultations over the counter for years now. Now in a room, we sometimes get a bit hesitant and scared, but use what you know. We've all got the skills, and we've got some of the best skills around. Use things like eyes. Why are you here today? Have you any ideas of what it could be? What are your expectations of this consultation? Because sometimes sometimes what they expect to happen and what you're thinking is going to happen is going to be totally different. So it's really important to understand why that patient's there and their expectations of you on that, the 15-minute consultation you have. And it's a golden 15 minutes to really make a difference. You may supply or you may not supply, but make that consultation count. Use Socrates, understand, is there something else going on? If they're presenting with indigestion or UTI, is there something else going on? Use your instincts. We're really good at that as pharmacists. If someone comes in and says, we all know I've got a pain in the chest, I think it's indigestion, we all automatically will think, hang on a minute, is there something else going on? Trust your instincts. We've all done it for years. Just use your instincts and just follow the process. And it's very, very well laid out for us with the system on farmer outcomes and the training we're all being provided with. Also, people may enter by the minor ailment scheme. So they might come to you and say, I've been referred for a sore throat. You do the examination, they've got fever, they're scoring high on the fever pain score. You see white exudate, you can flick them into the clinical pathway. So you're not stuck in a certain, if it's a minor ailment or a referral, you can move them across into a clinical pathway and say, look, my observations at this moment in time indicative of classic tonsillitis. Yes, you may think, am I right? Am I wrong? But at that moment in time, when you see that patient, your judgment, and as long as you've done the correct process on examination, it may turn out to be something totally different. But at that moment in time, when you're doing that consultation, you have followed the process and you've made a decision to supply. It's better to do so rather than not to if you believe that's a correct thing to do. And if further, if something changes later on and you're worried about that, safety netting is key. So have you told the patient if the symptoms get worse or they seem to deteriorate, or you, for example, against tonsillitis, difficulty swallowing, breathing, please contact A&E, give them information where they can go, or contact the GP. Claim for the work you've done. That's the most important thing I want to say here. We're going to put a lot of effort into seeing these patients, and it's really important we get paid for what we do. But going back to the initial thing for me, for this, I've been talking to Janice about it with absolute excitement because it really puts us in a real good light within the community. It takes us away from being, oh, he's a pharmacist who stands behind the glass and gives us our tablets. We're now clinicians. We're going to be counted as clinicians, and it's an opportunity here, really, to make a big impact on our communities and the NHS as a whole. Because we make a success of this, the list is going to grow, guys, and we'll be able to treat more and more and more. And how many times, I can guarantee there's 10, 15, 20 people on this call said, I've seen an insect bite on someone who's infected and I've had to refer them to the doctor. How frustrating is that? Not anymore, guys. We can actually treat them. And it's absolutely amazing. And have confidence and the passion to get behind the service. And it is a bit of chicken and egg at the moment. Is if I get 10 consultations today, how will I get my 3,000 items out by the end of the week? We've all got that challenge, but we're going to have to go through this rocky period, get our staffing and skill mix right, understand the service, and get our confidence right. For example, looking in the ears, what is otitis media? What am I seeing? The more you do, the more confidence you get. And every time you do a consultation, you'll become stronger, more proficient, and you'll gain confidence. And hopefully, the people who have done it are really enjoying the service, because I truly am. Because the satisfaction of able to treat an UTI or a child with otitis media is, for me, like I said in the beginning of my slide, is the biggest game changer we've ever had. And I think all of us should together be ambassadors for this service and just take it to the next level and prove to the NHS and prove that Greater Manchester can actually stand out from the crowd and really, really make a difference to the communities. And that's a summary from me so far. But if you've got any questions, I think later on Alison will be opening some questions up how the service has been. Please ask away, because I truly am really passionate around this service, and I'm not just saying that. I really do enjoy it, and I hope you guys do too.